What have you enjoyed most about being at the Gap Summit so far?
I think the thing I've enjoyed most about being at the Gap Summit is it's just the energy of the people who are here, because they come from such diverse backgrounds. They bring such fresh thinking that it's very stimulating for me, who's been in a particular area for a long time, to sort of mix and meet different people coming from all over the world with these wonderful new ideas.
And how do you think initiatives like Global Biotech Revolution and the Gap Summit, with a focus on earlier career professionals, international, people, bringing people together from all around the world, will shape the biotech industry in the decades to come, I guess?
I'm a big believer in the diversity of ideas coming from all sectors. One of my passion areas is this concept of convergence, of bringing engineering, the physical sciences, the biological sciences into a way to solve problems for health. And I see the Gap Summit and this initiative in particular around bringing people from all over the world with different ideas from these backgrounds to solving problems as the only way going forward to solve health in the broader area.
And I guess, why is it important for you, for leaders like yourself, to engage with the future leaders of tomorrow? Why do you think it's important for that to happen?
I think it's very important to engage with the leaders of the future because, I come from an industry which was quite traditional in its outlook. And what we're seeing today is that people bring multidisciplinary skills and are able to actually collaborate much more effectively across disciplines. And so I see that the healthcare and the pharma industry moving into an area which actually will blend technology and deep science into new ways to solve healthcare problems. And the new generation is the one that's going to own and democratize those solutions for everyone in the future. So I think it's a wonderful way to change our industry going forward.
And if you had one piece of advice, though, to give those future leaders of tomorrow, what would that piece of advice be?
I think my key advice to anyone coming in is remain curious and never give up, or don't be scared of failure, because I think that we're going to make many mistakes along the way. But so long as people are always looking and are interested in finding out more about the human body, the human health, and equalizing healthcare access across the world, I think you can't go wrong. So keep that passion and keep that vision in mind for the patient.
And you mentioned the democratization of healthcare, I guess. What do you see as the biggest challenge of making digital healthcare accessible to everybody?
I think that the biggest barrier I see is more today that digital health companies have a different focus depending on what your geography is. If you look at the Western or more developed countries, many people are trying to optimize outcomes even more for patients, whereas a lot of the digital health initiatives in other parts of the world is bringing basic healthcare access up to more people. So there's still going to be a gap between the access to innovation. But I hope that actually as technology and the costs come down and the freedom of information is more open, that healthcare access at the same level will become more accessible worldwide.
And I guess we've seen a lot in the news recently around data privacy. So in the digital health space, how do you ensure that you're collecting all this data, it maintains used in an ethical manner? There's privacy concerns for people these days, so.
Yeah, it's a big issue. I think data privacy and what happens with the information is going to be a big issue going forward, and especially with some of the recent scandals. But I still have a fundamental belief that we should not be trying to commoditize data of patients. I think the patient should own the data. If the patient owned the data and they gave consent for its use, and there was enough technology, such as a blockchain technology, that could protect their privacy, I think that could solve a lot of issues. We're a long way from that, but I think that would solve a lot of issues. I would willingly give my data if I knew I was going to benefit from it, i.e. something that I found out about myself could help me. But at the same time, if it gave an opportunity to individually commoditize that data for research, that's not a bad thing.
I guess a lot of the large tech companies now are getting into the healthcare space, IBM, Apple, Google. What are your thoughts on whether those companies will bring new revolutions to the industry and all the opportunities or partnerships with those companies, I guess?
Yeah, I think that I actually welcome the big tech companies entering into health. I have a slightly different view to some of the views expressed here today. That I think this view of convergence is still very strong. I think that the future organizations which bring the technology focus and the biology focus and work together in new models of collaboration will be probably a way forward. So I welcome the opportunity to learn more from the tech companies about health, that we can help them with biology and they can help us with some of the other elements that are around data analysis, understanding contextual behavior, behavioral data. That is not our forte. So I think that that's going to be a blend for the future.
Thank you.